And the question is, can we manipulate that? Can we use these implants, and can we sort of select our healing times in order to allow that to occur but still take advantage of the healing process? Well, the way we measure this is through resonance frequency analysis, or the implant stability quotient, the ISQ. These are old and sort of famous illustrations showing the smart peg and how it acts like a tuning fork on the implant surface. I have this unit now, which is a drilling unit combined with an Osstell device or an ISQ unit, although mine is reversed, that allows me to do this very efficiently every time I place an implant now. So all my instruments are together. I have the handpiece, I have the Osstell. Every implant I place now gets checked, and it gives me information that I'll show you in a second. As you know, the Osstell sort of excites the peg, causing it to vibrate, and then we get a reading back. That gives us some idea about what the stability of that implant is, and also if we do it over a period of time, it gives us some implication of what the healing is like, and that's really important. If we have too much micromotion, it may mean that there's a poor chance that this implant will integrate, or it may mean it needs more healing time, and it's up to the clinician to decide how to interpret that information. There is a scale that's come up over time that gives us some idea of where these stability measurements are. Low would be considered around below 60, high perhaps over 70, and most implants that I place fall somewhere in the mid-60s, low to mid-60s.